Okay, we're now on part 6 from this book right here, Prevent and Reverse AFib and CHF by me, Pete Rogers. We briefly talked a little bit about the epicardial coronary. So you can imagine if this is your heart, if this is a heart, this thing right here, the fingers on top would be the epicardial coronaries, or the big arteries on the outer surface of the heart. Pericardium is the outer layer of the heart. The next layer inward is the myocardium, the muscle tissue itself. And then the inner layer that's in contact with the blood in the heart chambers, that's the endocardium, okay? So these big arteries on the outside, everybody knows the name of these: left main, the widowmaker, the left circumflex, the left anterior descending, then there's the right coronary. Okay, but these little tiny branches coming off them, those that go into the muscle itself, the intramyocardial branches, they're the penetrating arteries. And those are the ones that can get plugged up with these floating clots, these fibrinoid clots, these amyloid clots, they're also called. Okay, so that's why you don't want leaky guts. They're called amyloid clots or fibrinoid clots. Just to also give you perspective, this coronary artery microvascular dysfunction. These are patients who will go for cardiac cath, and the cardiac cath comes back normal, but they clearly have cardiac anginal symptoms. Okay, they're difficult to treat with medications. You can't treat them with coronary artery stents. You can't treat them with cabbage. You know, best option is going to be the Esselstyn diet, low-fat vegan diet. Okay, in general, they're considered to have a relatively poor prognosis. And what I'm saying is, doctors don't know about this amyloid clotting thing. It's pretty basic. Here's the two big pioneers on the subject: Douglas Kell, the PhD from England, and Etheresia Pretorius, PhD lady from South Africa. And here's their paper: Fibrinoid microclots and atrial fibrillation. Bottom line is you get leaky gut, you get LPS, LTA, bacterial endotoxins in the blood, and they cause a lot of clotting. Atherosclerosis is a blood clot. And you start getting these little clots in the myocardial branches. You can disrupt the conduction pathways of the heart from the left atrium to the AV node for ventricular conduction, and that can cause AFib. So you know what to do to avoid them. Eat your fiber and avoid all those things that cause leaky gut. We talked about how those you should be eating a minimum of 50 grams of fiber per day. Minimum. Average American only eats about 5. It's a joke. Okay, I think our ancestors were probably pretty routinely eating about 100. And then there's other things that are toxic to the gut lining: the aluminum in tap water, the fluoride in tap water. So you got to filter your water. The chlorine a little bit. Drinking alcohol is toxic to it. Glyphosate in the the non-organic food. All right, and there's a whole bunch of other things. A lot of preservatives and emulsifiers in processed food. They're all toxic to the gut. Excessive psychological stress, sleep deprivation, caffeine, they're all, have a negative effect on the gut. Okay, animal foods have a lot of sat fat. They're all bad. So that's a big thing to know about. I'm going to tell you one more thing too about fiber. We'll call it a day after this, but this is another big academic orgasm. So basically, the good gut bacteria, they feed on the fiber, and that keeps them healthy and happy. They make the butyrate, that maintains the gut lining. But now you also can have bad bacteria in your gut. The more fiber you're eating, the more you favor the good bacteria. The more you're eating processed food, junk food, fast food, meat, the more you get the bad bacteria in there. The bad bacteria have more of an enzyme called glucuronidase. So normally the body, when it has elevated estrogen levels, it sends some of that estrogen to the liver. The liver conjugates it with another molecule, adds a molecule to make it more water soluble, like glucuronic acid. So now that's called glucuronidation with glucuronic acid. That gets secreted into the bile. Okay, that's the outflow from the liver that then goes into the intestinal tract. All right, that's what gets stored in the gallbladder. And anyways, so the estrogen, when it's conjugated to the glucuronic acid, it then gets excreted by our body through defecation. But if you got more bad bacteria, they got more of this unique enzyme, glucuronidase, they will cut the bond between the estrogen and the glucuronic acid, and they will cause it to be reabsorbed into the body. Because once estrogen is deconjugated, you don't defecate it out of your body. Instead, you reabsorb it into your blood. And so, lots of people are eating processed food and they're drinking tap water. Well, that's a setup to get yourself in trouble here, okay? The tap water is going to have lots of estrogenic materials in it. The processed food have a lack of dietary fiber, and you're going to get more of these bad gut bacteria, and they're going to deconjugate your estrogen. So instead of excreting out of your body, you reabsorb it, putting yourself at increased risk for breast cancer and for endometrial cancer, and for especially fibroids. I see lots of fibroids every day. So that's the big mystery of one of the ways you avoid it. Don't stop using deodorant. Deodorant's for stupid chumps that are conformists. You walk in a room, you say hi, you don't sniff each other's armpits. Because that estrogen, you're putting an estrogenic chemical in there through the preservatives, parabenzoic acid, aluminum is a metalloestrogen. A lot of women shave their armpit, increasing transdermal absorption, and biochemistry like dissolves like. So the lipid nature of the estrogenic molecule with the lipid nature of the skin causes increased absorption as well. Skin's primarily lipophilic, meaning like fat. So that's why you can swim in the water and not have it absorb into your body. Okay, we're made for that, but we're not made for putting these lipid-like chemicals on our body. These estrogenic preservatives and whatnot. So, anyways, those are the take-home points for today, and it's also slightly prothrombotic. So all those things are not working in your favor for preventing atherosclerosis, preventing AFib.